Hello everyone. Today I shall discuss one of the competencies from AETCOM book, and that outlines the steps for communication with patient with empathy and ethics about appropriate use of a drug. Here I will take the example of thyroxine tablet for a patient with mixed edema. As we all know, medicine is not only drug plus information given to the patient for its proper. While communicating with the patient about appropriate drug use, we have to acquire adequate knowledge of communication and skills to communicate so that this communication becomes effective communication, and we have to incorporate empathy and ethics within communication so that it becomes the right communication to the patient. A study has shown that about 70% of the medication errors are due to poor communication. We should know what are the essential components of effective communication. In simple terms, 8 essential components are: greet, put the speaker at ease, show your interest to listening, understand patient's needs, remove distractions, empathize with the speaker, be patient, hold your temper, invite questions and ensure that communication has occurred, and finally say goodbye. It's here again shown that proper eye contact, body language, observing silence sometimes, showing smiling face, and active listening, asking questions, using a soft tone, and continuous engagement are the harbingers of good and effective. Empathy is defined as the ability to understand and share the feelings of another. It is derived from Greek empathia, that means feelings. Unlike sympathy, there is a greater involvement of affect in sharing concerns based on understanding of patient's emotions and perspectives. Doctor has to be aware and get emotionally engaged in the feelings of the patient, and that can be done and initiated by active listening. Advantages of empathic communication are many. There is a reduction in anxiety, reduction in the stress, there is removal of uncertainties, there is less depression, less morbidity, less use of many drugs, and enhancements of adherence to therapy. Ethics is the use of moral behavior, and moral behavior is based on values and principles. When one values principles and morality, his conduct will be ethical, and professionals do ethical work. Medical ethics is a system of moral principles that apply values and judgments to practice of clinical medicine and in scientific research. Key features of ethical communication are honesty, objectivity, integrity, carefulness and keenness, openness, respect, confidentiality, and non-judgmental attitude. There are advantages of ethical communication that include: it fosters trust and faith, promotes adherence, and reduces medication. Now, when we use ethics in communication, the 4 principles of ethics are useful and they have become very evident. For example, by autonomy, we respect patient's choice for drug intake, and requisite will be right of the patient to adequate information. We have to get information. It is patient's right to know about the details about the drug he has to take, or he has to give consent for any surgical or other procedure. Beneficence is an important principle, that means do good and no harm. So beneficence is a quality of being kind, charitable and beneficial. Adequate drug related information is always beneficial to patient. By non-maleficent, we know first do no harm. Therefore, we must provide, supply sufficient information about drug-related safety issues and do not hide something from the patient. And justice is give the all possible information and provide opportunities to all patients suffering from similar disease. Now let us look at the appropriate use of L-thyroxine and how we can use the ethics and empathy during communication about appropriate use of L-thyroxine by a patient with hypothyroidism. One aspect is we have to explain why is this medicine for him or her, what benefits will patient accrue from its proper use, and how the medicine is to be taken and how does it work, how long has he or she to take the medicine, and how to monitor the drug therapy. How would dose vary according to the concurrent disease or pregnancy in females, and what to do if dose is missed. These are essentials for proper drug use. Another aspect is how the medicine is to be obtained, how it will be stored, and what is the refill information. Is the medicine generic or branded generic? Can different brands can be exchanged? Color codes for different strengths should be known so that they are not misused, and explain why tablets are dispensed in amber colored bottles so that patient can properly store away from the direct sunlight, humidity and high temperatures. Another aspect is how best to avoid unwanted effects and ensure regular use. We have to explain that what precautions have to be taken during drug intake. Always see that your pulse beats are not irregular or rapid. If pregnancy has occurred, any new illness has occurred, medicines are not available but seem different than earlier supplied. If allergy has occurred after taking medicine or new symptoms have appeared after taking medicine, if the patient is undergoing surgery or anesthesia, it should be very clearly stated that these medicines cannot be shared with other patients because every patient has a different dose requirement and some foods are to be avoided, for example, cabbage. Now, encourage patient to nourish her own apprehensions. Often cost restricts affordability and that leads to poor compliance, and most of the time we don't have time to listen to patient concern. Therefore, it should be our endeavor to provide a lot of information about low cost generics available at many drug outlets. Aspect 4 is about regular monitoring and periodic consultation. Self-monitoring by measurement of the heart rate and keeping a record, and then also taking weight weekly. And all the record has to be brought during next visit. Blood test may be done sometimes, maybe every 6 months. Thyroid function test, T3, T4 and TSH level, so that adequate dose regulation is done. How drug has to be taken. Now here is a communication which has been recorded and placed on YouTube where patient and doctor actually communicates and doctor explains how levothyroxine has to be taken by the patient and allays all the apprehensions and replies to all the queries patient has, and you will appreciate that it is very important that doctor must listen actively, carefully and reply to the patient. I will request everyone to go to the video on the YouTube and the link is given. Thank you very much.